Well, if you suffer from arthritis and joint pain, a laser could help. Dr. Drew McPhail of McPhail Chiropractic is here to tell us about his high-powered, and that word high-powered is high-powered, but there's no pain. There's just a little bit of a cold laser that touches your hand. It's the only one of its kind here in the Lowcountry. And I think I got that pretty much right.
Yes, sir.
Because you've had this on me before, on my right knee, and I suffer from jumping out of perfectly good planes for 33 years. The laser is actually cold, and it goes in and rejuvenates maybe some of the tissues.
The tissues that we're treating, whether it's a shoulder, a knee, a hip, arthritic changes. Basically, it stimulates the healing response. It gets the inflammation down really quickly, and then helps calm the nerve fiber, the pain fibers, one that allow you to know that you're in pain, helps calm them down so you get some really good results very quickly. It's called the Cutting Edge MLS M6 robotic laser. Now,
the only one in the Lowcountry. There's one other one, but that's all the way in the upstate.
Up in Greenville area,
sir.
yes, sir. And what we're able to do with it, we're able to actually treat specific areas, okay? Instead of, like when you take medication that goes throughout your entire body, trying to decrease inflammation. With this, we can go specifically to the area that's involved and treat it. And by doing that, what it does is with the cartilage cells in the joints, as they erode away as we age, well, they become much weaker. And when the cold laser is going in there, what it does is stimulates the power plant of the cell so they can actually regenerate and they can heal. Basically stimulates the healing response.
Because a lot of times after those areas start to degenerate, you start to receive that bone-on-bone situation, and this regenerates in between those two.
It helps increase the synovial fluid in the joint, which makes it move much more easily. Also helps to regenerate the cells that are in there so that you do have more cushion in those joints.
And this, the way it's designed, can actually come up. I could be laying on a table and I could have my knee exposed, and you could bring that right up alongside the table, and I'm sitting there relaxing, probably taking a nap while this is.
A lot of patients.
A lot of people do.
They do fall asleep during the treatment. I have one gentleman who had bone-on-bone knee pain. He had surgery on one knee. He was told he was going to have surgery on the other. He didn't want to go through that. He also had a history of jumping out of perfectly good airplanes as well. And he said he'd use that time to meditate. He'd just lay back. He said there's no pain involved, and now he's able to stand and walk, and he enjoys it much better in his golf game.
Not only knee pain or knee restoration that this will help, but also the elbow, the shoulder, a number of areas.
Treat a lot of patients with frozen shoulder who are unable to raise their arm past horizontal. And after a few treatments with some other rehabilitation, we're getting them up to where they get full range of motion, able to reach up into the top counter where they couldn't reach before. And in this, like right here, the patient would be seated here, and we can have the laser going right on their shoulder.
And it seems to be, I've talked with people that have come to your office, before they get there, before they ever meet you, they're frustrated because they still want to live a full life. And these are people in their 40s, 50s, 60s, and even older. They want to live a full life, but their range of motion is just not there anymore. And how can we restore that range of motion after a thorough examination? Sometimes this is the answer.
That's right. Yeah. Well, it's very debilitating when you lose the use of an extremity or both your knees. Okay, you're unable to go walk, stand, and be stable. And as we age, one of the major risks is falls. Okay, and if you're up 50, 60 years old, 70 years old, you fall, you break your arm, you break your hip. Okay, you can lose your independence. And with this, it allows the patient to be much more stable and much more comfortable. And it's just providing phenomenal results, and we're just really happy to be able to offer this to the community.
You have this, you have the thorough examinations, you also have the table, because I was at your office a couple of months ago, you also have the table that gingerly takes a little bit of the stress different areas of the spine.
Yes, and we could also incorporate the laser with this as well. People who suffer with degenerative disc disease or herniated disc,
a lot of people
spondylosis or spinal stenosis, where the discs have degenerated. What we're able to do through our AcuSpina IDD therapy, we can actually decompress those discs, which gets the pressure off the nerves. Then we could use our MLS M6 robotic laser to help decrease the inflammation and stimulate the healing response. And I mean, these patients are just loving it. They're getting better every day.
It's great to have you here on a Tuesday because you also have a free seminar coming up a little bit later on this evening. Tell us about that.
Yes, I do. At 3 o'clock at my clinic, we have I'm going to be talking about chronic joint pain, knee pain, shoulder pain, what some of the common presentations are that we're able to treat in this clinic, and exactly how we effectively manage it.
Exact address there on Old Trolley Road?
It is 1709 Old Trolley Road. That's on the Dorchester Road side. We're in between Pivotal Fitness and Dorchester.
Very good. Dr. Drew McPhail, always a pleasure.
Thank you,
Go
Tom.
and see him. A lot of people do, and a lot of people continue to praise him on what he's doing right here in the Lowcountry. Coming up next, it's the art and therapy mixed together. See how drawing is helping people heal after Manual 9 shootings.